It's 7 o'clock, which means you're watching The Only Breakfast Show, live from Westminster. A vaccine milestone reached and the rollout of the next stage beginning. But just when might we start to see those different lockdown restrictions ease? We'll be asking the Health Secretary in just a few minutes' time. Indeed, it is a show packed with voices from the vaccine frontline this morning. We'll be speaking to one of the country's top vaccination officials, plus the National Medical Director of the NHS. We'll also be chatting to the World Health Organization. Also ahead. Love this. Dancing his way to fitness and happiness. I'm going to be speaking to the 85-year-old Alan Beattie, whose online tap dancing classes are helping to keep people all over the world on their toes. It is Monday, the 15th of February. The vaccine rollout rolls on, with more than 1 million new letters sent out as we begin phase 2. Still, we are also asking, when might those different lockdown restrictions ease? As England's hotel quarantine plans kick in, we're live at Heathrow Airport to get a first look at passengers arriving from those red list countries.
And we're live here in Tel Aviv in Israel at the heart of the world's most successful vaccine programme. But what can we learn about their experiences here? Tanks on the streets and shots fired at a protest as tensions and fears rise in Myanmar following the military coup. A picture of happiness. The Queen says she's delighted as Harry and Meghan reveal they've got another baby on the way.
And it's looking much milder this week, but it will be unsettled with often wet and windy conditions. I'll have the details for you later in the programme.
Morning all. It was, clearly, an ambitious target, but phase 2 of the vaccine rollout has begun today after more than 15 million people received their first coronavirus jab. Meanwhile, new measures come into force at the borders today to try to stop the import of new variants. Let's just run you through some of the key points of the day. Letters, contact has been made with over 1.2 million over 65s and the clinically vulnerable to invite them to make an appointment for the vaccine. A similar number of invites is expected to go out this week. Today, England's hotel quarantine plans come into force. Nearly 5,000 hotel rooms have been made available, with a further 58,000 on standby. New checks will begin at airports today on passengers coming in from red list countries. We'll be live at Heathrow Airport in just a few moments. But first, Sky's Caterina Vitozzi reports on that 15 million vaccination target being achieved.
To get 15 million people vaccinated in 10 weeks, this is what it takes.
Check in at the desk, please.
Peter Morale. This GP surgery is in West Yorkshire.
Just come this way, sweetheart.
But the hustle and bustle you see and the hope you sense has been felt across the UK.
A number of our patients have not left their house since last February, so the excitement of them attending for their vaccination. We've seen tears, we've seen people anxious, just wanting to get life back to normal.
15 million people. It's such a large number, it can be difficult to visualise, so perhaps this will help. 15 million people is the entire population of London. It's everyone living in Birmingham, Edinburgh, and the entire population of Wales. That's 15 million people who've either been offered a first dose, the majority have accepted it, and some have even had it twice. And it's been done by setting up mass vaccination centres like this one in Glasgow, by pharmacies operating like clinics,
heading out with one AstraZeneca vial,
by GPs delivering vaccines by bike to the vulnerable, or by bus to the uncertain.
Hello, my name's Marion, I'm the pharmacist here.
Having in various sites encourages different aspects of the population who naturally don't always come for vaccines very easily, but having it in a more familiar location really helps them feel confident.
We just live up the road, so even if I was having a bad day, we knew we could get here.
There's also been an army of volunteers, some from medical backgrounds.
Are you on any blood thinning medication? No.
Others just wanting to help the NHS.
I had a major car crash 18 months ago. By all accounts, wasn't survivable on the day. It's been quite a journey. I've had to learn to walk again. My feet were very crushed. But for me, to be able to give something back is just phenomenal.
And with the 4 most vulnerable groups reached, attention turns to those who are next.
My husband's extremely vulnerable, so we've been kind of extra restricted. My granddaughter has cystic fibrosis, so we've kept away from her a lot. So that hope for us is, you know, we're dying to get out the door and do something.
Freedom, normality, hope. That is what the vaccine means to most and what it might bring to all. Katerina Vitozzi, Sky News.
To the Health Secretary in just a moment, I hope. But still to come on the show this morning, I'm going to be meeting the man leading the military's support to the UK's vaccine rollout, Brigadier Phil Prosser, joining us on the programme at 7:30. At 7:45, we'll be speaking to the World Health Organization's special COVID-19 envoy, Dr. David Nabarro. I'll be asking him whether vaccine passports are the way to reopen international travel. At 8:05, we'll be speaking to Professor Anthony Harden of the Vaccination and Immunisation Committee about the next steps of the rollout. But as trailed, very pleased to say, joining us once again on the programme, the Health Secretary, Matt Hancock. Minister, great to have you on this morning. And I just have a quick check on the feed from the Red Room to see if you are still dancing that little jig you spoke about at the weekend. Look, I think it's fair to say you and I have had our run-ins on this programme over recent weeks and months. Credit where credit is due. Well done. We hit the 15 million target.
Thank you. I'm really, really proud of the team. We hit it 2 days early. And right across the whole of the UK, managing to ensure that everybody in groups 1 to 4 is offered a jab, and got 15 million jabs done. I mean, but you know, you say that I dance a little jig. That was referring specifically to, you know, when members of my family got vaccinated, and I know that for millions of people, this is such an emotional moment because it's the moment that protects us, and also is just a little step towards freedom for us all.
Yeah, I would, of course, participate in a similar little jig myself. Members of my own family have had the vaccine, but I think there are probably Ofcom regulations against such a display at this time in the morning. I suppose the problem for you, if indeed there is a problem, is that one target is done and it's straight on to the next one, isn't it? You know, the end of April becomes the next important date in the vaccine timetable.
Yes, that's absolutely right. There's no rest for the wicked, and we're straight on to the next groups. So the letters have already been sent to over 1 million over 65-year-olds, inviting them to come forward. And also the next group after that is those who have underlying health conditions and are carers. So there's a huge programme obviously underway, rolling out to invite the next group of people to be vaccinated. And at the same time, from next month, we have obviously the second jabs of all the people who've come since January to make sure that those happen on time, because they have to be within a specific 12-week time period. So there's still obviously a huge amount of work to do, but we have managed to vaccinate those who are most vulnerable. And the single thing I'd pick out, if I may, in the programme, in terms of how it's going, is the uptake is much higher than we expected. Over 90% for all of the over 70s, over 97% now for people in their late 70s, which is the group where the uptake is highest at the moment. And so whilst going to younger age groups and going broader, we will also keep going back to those who are most vulnerable to offer them a jab if they haven't come forward yet, because getting that uptake to as high as it possibly can be is really important for protecting us all.
A metric identified by you and others is absolutely critical to the way in which we come out of this is, of course, mortality in those top two most vulnerable groups. That will give us the clearest indication that the vaccination programme is working. Are we at that point yet? Have we got any data that suggests that that is already happening? I mean, we have been vaccinating, I think, since, what, roughly second week of December now?
Yes, we've been vaccinating since the 8th of December. That's when Margaret Keenan got her jab. And the signs are that, thankfully, the number of deaths is falling and has been now coming down for a few weeks. It's too early to say whether that is directly due to the vaccination programme yet. In those first couple of weeks in December, the numbers were relatively small. You know, we're going at 500,000 a day now, whereas in December we did 1 million in the whole of December from the 8th through to New Year. So it's too early to be able to measure the direct impact, but of course we're looking at that, and we can see overall that the number of cases is coming down sharply. The numbers in hospitals is coming down, but it is still too high. You know, on the latest count, there's still 23,000 people in hospital with COVID.
I wonder then if you might speak directly to members of your own parliamentary party, the COVID recovery group. They again are making the point, look, if we keep up with the pace of vaccination, and everyone is expecting we are, given how well we've done so far, by the end of April, if we have vaccinated those most vulnerable groups, why are they wrong to link that moment to the end of lockdown?
Well, we've got to watch the data, and I talk to Mark Harper and others all the time, because everybody wants to get out of this as quickly as we safely can, and both as quickly but also as safely are important, and that's what everybody agrees with, you know. And the question is a judgment of how quickly and safely. How quickly we can do that safely. That's the judgment that we'll be making this week, looking at the data ahead of the Prime Minister setting out the roadmap on the 22nd, so a week from today. So these are the judgments that will be made this week, and we'll talk to everybody who has an input into that debate, because it's a very important and a fine judgment.
Can we then be specific? When we say we're looking at the data, which data will we be using as absolutely critical to the relaxation? I mean, we look at a couple of key moments in our pandemic response. July the 4th last year, when pubs, restaurants, hairdressers reopened, we were recording, I think it was 650 cases roughly. When last non-essential shops reopened, we were recording around 1,000 new cases. Yesterday, it was, pretty much 11,000. We are a country mile, are we not, from the type of relaxation that the COVID recovery group wants to see?
Well, there's a long way to go, and in a way, the most important message remains the message for everybody to stay at home and abide by the rules. I mean, it's pretty. It's pretty extraordinary and very positive how people are following those rules even after all this time, and I'm very grateful to everybody. In fact, the support for the measures that we've taken is just as high as it was in the first lockdown, and you can see that the number of people who are following the rules is just as high as it always has been. But I know how the pressures that they bring. Of course I do. And so you're right, there's a long way to go. There's too many people still in hospital. And sadly, the number of deaths each day is still too high. But it's these measures, hospitalizations and deaths, as well as, of course, the success of the rollout, the vaccine rollout, which is going really well, that we'll be looking at, and making sure we're vigilant to ensure we don't have a new variant that blows the whole thing, makes the whole thing more difficult. And that's why it's so important that we take tough measures against new variants as well.
Sure. Once again, though, Monday morning, you go through the papers, as I'm sure you do, the same as I, and there are any number of measures that are being floated there this morning. You know, being able to meet up with your grandparents, you know, being able to sit with a friend on a park bench, the possibility of, you know, self-catering holidays in April. I mean, can you confirm or deny any of those? I mean, actually, just on the holidays thing, you told us last week you were off to Cornwall. You didn't tell us when. I'm wondering if that might give me an indication of when I could be booking.
No, these decisions will be made this week, and the Prime Minister will announce them on Monday week. I know there's a lot of speculation. Of course, there is. These are important.
The speculation is not helpful. I mean, shouldn't we be part of this conversation? Can we not be trusted to be part of this conversation? And by we, I mean the population as a whole.
Well, you are part of the conversation because you're asking me questions about it, and lots of people are making their views and their preferences clear. There's a debate in the newspapers. I think that's totally reasonable given the scale of these judgments. And we'll look at the data and take advice, and the Prime Minister will set that all out on Monday.
Sure, but OK, another aspect of the response, which I feel kind of is parallel to the point I was making there, vaccine passports. You know, we heard that vaccine passports weren't going to be happening. That was Nadhim Zahawi. We heard that they were a matter perhaps for the private sector. We then heard from the Foreign Secretary yesterday saying the matter is under consideration. Now, which of those is it? And do you see why some people are somewhat confused? You know, the Foreign Secretary, it can't get his words right when it comes to whether or not we've got a vaccine passport on the way. How can the rest of us cope?
Well, let me tell you exactly what the situation is. There are some countries around the world that are considering bringing in rules saying that you can only travel if you've been vaccinated. These aren't in place yet, but there are countries that are actively floating this idea and proposing it. And in that case, it will be important for people from the UK to be able to show whether or not they've been vaccinated in order to travel. And so we're working with countries around the world on the basis for this and how that vaccine certification can happen in a way that can be assured. Because obviously, you know, if you're a country that's saying you can only come in if you've had a vaccine, you'd want to have confidence that a person saying they've had a vaccine has had a vaccine. And we'd want Brits to be able to travel to those countries. And therefore enable Brits to be able to demonstrate their vaccine status. And so that sort of vaccine certification is something that we're talking to our international counterparts about. And you know, it is, and there's people who are arguing that that is the right way to have safe global travel again once, you know, because obviously that's very restricted at the moment. And that's obviously an important piece of work.
What, just briefly, because I know you're about to, we need to let you go, but what of the having to prove your vaccination status, not to access government services, but to access services provided by the private sector? Do I need a vaccine passport to go to the pub when they open?
Well, we do not have plans to do that. As I say, there is this international work going on because of the, you know, because if other countries require that, we want to allow Brits to be able to travel to those countries in the same way that for parts of sub-Saharan Africa, you need to have a yellow fever certificate. I know I've got a crumpled old yellow fever certificate from when I last traveled to sub-Saharan Africa. So that is these things have happened and still happen in parts of the world. And obviously, we'd want to be able to facilitate that sort of vaccine certification, but it isn't anything we're planning to introduce here.
Minister, we do have to let you go. Got to say, we won't talk about the Six Nations result at the weekend, but I'm sure you'd be very pleased to say that I took your advice. My boy and I were out in the park playing rugby this weekend. Matt Hancock, great to have you in the programme this morning.
Thanks for having me.
Once again, our political correspondent, Kate McCann, listening into our chat with the Health Secretary. Morning, Kate. What struck you?
I think it was interesting. I mean, there was loads of good news in there, wasn't there? It's important to start with that, I think. 15 million vaccinated is a great target. Matt Hancock said we move on to the next one, which is, of course, the end of April. Really positive news for anyone out there this morning who's watching, wondering when they might be able to leave the house, feel comfortable seeing family again, feel comfortable going to the shops again for lots of people. So that's great news. But I think it's more difficult when you start to ask about how things are opened up. And you did get some clarity from Matt Hancock there on what exactly they're looking at when they talk about this data. He was talking about hospitalisations, number of people in hospitals, still 23,000 people there. And we know that people with COVID can end up in hospital for a long time. So that might take some time to ease off. Also about mortality, how many people are dying from the virus, and key will be vaccinations, how well that goes too. Any issues with supply could throw that off course. And also then he mentioned in there too, new variants. A key area today will be quarantine hotels at the border. If they work well, that would be positive for the government.
Well, we should have a rough idea by this time tomorrow. For now, though, Kate, thanks very much indeed. Well, as Kate was just mentioning there, England's quarantine hotels will be receiving their first guests today. But there are some concerns about the plans. Heathrow Airport say they're worried as queues at the border in recent days have been almost 5 hours long. Sky's Milena Veselinovic is there for us this morning. Good to see you. Yeah, I can see you now, Milena. Good to see you. Of course, we're a few hours away from the first flight that will be sending people to quarantine. And we know that there have been some concerns expressed by Heathrow Airport, amongst others.
An extra border police has been deployed to try to deal with that issue. But I can tell you, Neil, that the first passengers from these red list countries are now in baggage hall waiting to pick up their bags, and then they will be escorted through these doors behind me to a bus which will take them to one of these quarantine hotels. I'm also told that they were queuing in a different line in order to get to border control to other passengers in order to try to isolate them as much as possible, really. And before they set off, they would have had to have pre-booked one of these quarantine packages at a cost of £1,750 per person. If they get here without having one booked, well, they're liable for applying up to £4,000, and they'll still have to pay for the package anyway. Now, Heathrow, where I am, is just one of 5 airports where you're allowed to arrive to if you're coming from one of these red list countries. If you turn up anywhere else, you are liable for a fine of up to £10,000, and you'll still have to pay for transport to the next port of entry that is allowed. So it's very expensive. Now, once people are collected and they're escorted to their buses and they're taken to these hotels, they'll be confined to their rooms. If, for example, they want to go exercise, well, that's at the discretion of the security staff, so it's not guaranteed. And what we don't know is that if they are allowed to exercise, whether that would be in the gym or perhaps somewhere outdoors in a courtyard. There's not exactly weather for it right now, but I don't know. We'll see. There are small exemptions, such as hauliers from Portugal who are allowed to come here without quarantining, as well as diplomats.
Milena, thanks very much indeed. Big day in terms of vaccinations. Pleased to say we've got a number of specials on the rollout, rolling out themselves at 1 o'clock, 4 p.m. and 8 p.m. on Sky News. In fact, the 8 o'clock special, taking a closer look at why there's that issue of vaccine hesitancy among some parts of the Black and Asian communities. Now, armoured vehicles have rolled through the streets of Myanmar this morning after security forces opened fire during a protest at a power plant. Let's get the very latest from our Southeast Asia correspondent, Siobhan Robbins. Morning, Siobhan. What on earth is going on in Myanmar at the moment? Those shots fired at the protest seem to follow that uptick, which we were commenting on at the tail end of last week in terms of the response from the military.
Yeah, a really tense weekend again in Myanmar. So we've seen these armoured vehicles roll into cities including Yangon and Sittwe in Rakhine State, but also last night in Kachin State, protesters who were demonstrating outside a power plant were dispersed by force, with authorities using water cannon and rubber bullets. And one of the residents who was there told us what she saw.
The security forces started to disperse the crowd. They were opening fire using rubber bullets. There were so many shots. They also used tear gas, and some people got hit in the head and legs and were injured.
The military do seem to be clamping down at the moment, and it's not helped by the fact that there are so many rumours, which of course have got worse because, again, overnight the internet was turned off between 1 and 9 in the morning. So people really worried about what's happening during those internet blackouts. And at the same time, Aung San Suu Kyi, who was expected to appear in court today, has been remanded for another 2 days, with her lawyer, who I've spoken to several times, saying that it's difficult for him to get access to her. He is trying to access her, but we should get another update about her situation on Wednesday. But I don't think anyone in the country is expecting her to be released.
Siobhan, many thanks. Now, food and delivery bosses are urging the government to reintroduce the Eat Out to Help Out scheme when restrictions are eased. The return of the scheme is one of a number of recommendations to support the hospitality industry set out in a letter to the Prime Minister, signed by Deliveroo and 330 restaurant partners, including Pizza Hut and Itsu. An NHS study has found that CT scanning can detect 70% of lung cancers at an early stage. Experts are now calling for routine scans to be offered to smokers and ex-smokers, which could save thousands of lives every year. The father of the missing chef, Claudia Lawrence, has died without ever knowing what happened to his daughter. Peter Lawrence lost his life in York, aged 74, following a short illness. His death comes 12 years after his daughter Claudia went missing. Police believe the 35-year-old was murdered, but her body has never been found. Well, let's return to the race to vaccinate against coronavirus and head to Israel, which, of course, has been a couple of steps ahead of us throughout the pandemic. We've got some news from there this morning on their vaccination programme itself. Let's speak to our Middle East correspondent, Mark Stone, inside a hospital in Tel Aviv for us. Good to see you, Mark. As you mentioned, in what we describe as the openers, that bit at the top of the programme, big question when we look towards Israel is, what lessons can we learn from them at the stage that they're at in their vaccination rollout?
Yeah, morning, Neil. Israel's been ahead of the experience curve, I suppose you could say, over the course of this pandemic. And it's sometimes been positive and sometimes been very negative. I mean, they locked down very quickly back in March last year, but then they came out of that lockdown far too quickly with disastrous consequences, a massive spike in the number of cases. But as we've been reporting over the course of the past few weeks or so, the vaccination program here, and you can see just inside one hospital, is underway now, and they are vaccinating many hundreds of thousands of people. At this hospital alone, 103,000 people vaccinated so far. But have a look at this. This is worrying, potentially. Empty seats. They have seen a massive fall-off in the number of people willing to get a vaccination. They want 90% of the country to be vaccinated. It's not happening at the moment. They had lots of uptake early on, but this could be a glimpse into our future as we try, and you were talking to Matt Hancock earlier on, as we try to vaccinate more and more people. They are finding here that younger people are less willing to be vaccinated. If we squeeze through here, I want to introduce Professor Ronnie Gamzu. Thank you for talking to us. You're live on Sky. I guess we could sort of call you Israel's Chris Whitty, who is the advisor to the government. At one stage, you were advising Benjamin Netanyahu. It's a rotating role, but you're also the director of this hospital. How are things?
Yes, we are now continuing the vaccination plan. We are reaching now almost more than 4 million, reaching almost, more than 2.5 million, 2 doses of vaccines.
And this is a small country, we should point out, 9 million people.
Of course, almost 40%. And I must say that we see the effect of the vaccines. And we are admitting each day around 20 severe patients. No one of them, almost no one of them, is after the vaccination. All of them are non-vaccinated, meaning that the vaccine is really effective and is working. And this is really the plan to go out of the epidemic. And this is what really is happening now.
But the problem, and we can see empty chairs out there, the problem is you are seeing now a drop-off in the number of people willing to have the vaccine.
You know what? If you will look at the sick funds, they are continuing the dynamics. Here we are looking ahead and completing many other people that are, not the regular people that are under the sick funds. We are vaccinating all the diplomats around the Tel Aviv area. We are vaccinating all the illegal residents that do not have sick funds. So we are looking at each person, trying to attract them. And you know what? Relatively, we are succeeding. And this is what's happening also in the young people.
All right, Professor, thank you very much for joining us. And they're using a carrot and stick policy here now. So the health minister is proposing, and you were talking to Matt Hancock about this, Neil, the health minister is proposing that if you haven't been vaccinated and you can't prove it, you won't be allowed to go to the bars, shops, restaurants, gyms. You will be banned from entering. Pretty draconian, but they're looking at it very seriously here as an option to get the country back to normal.
Mark, many thanks indeed. More from Mark through the day. Now, you may have noticed a little bit of news this morning. A new royal baby is coming. The Queen says she's delighted. Joining us now, our royal correspondent, Rhiannon Mills. Morning, Rhiannon. So, a man and a woman are having a second baby.
Yes, I suspect there'll be a few people around the world who'll be a little more excited than that. Certainly the pregnancy announcement last night came in a way that we wouldn't usually expect from members of the royal family, with that very intimate photograph that is splashed right across all of the front pages this morning. Harry sitting there on the grass with his bare feet, Meghan lying with her head on his lap, and yeah, they could not be happier to share with the world that Archie is going to be a big brother. I have to say, last night it does seem that the way they announced it did slightly get the palace on the hop a little bit. It took a bit of time for us to hear that the Queen and the rest of the family were delighted. That's despite the fact that we're told that Harry and Meghan had told them that they were expecting a baby. But I think it shows that the couple really want to control the way that they release their news now that they've stepped away as senior working royals. But yes, all babies are special, but this one is certainly going to be unique. The first of the Queen's great-grandchildren to be born abroad, despite it will be 8th in line to the throne.
Rhiannon, many thanks indeed. Now, it has been, a weekend of fairly changeable weather, and it looks like we might start to be easing out of the cold spell. Naz is here to tell us whether or not that is true. I mean, I saw reports in one of the papers this morning that next weekend we could be seeing temperatures as high as 15 degrees Celsius.
Yep, it is going to be an incredibly mild week for most places. It's already mild out there this morning, except for parts of the northeast. It's a bit chilly there. But with the mild conditions as well, we are going to see rather wet and windy conditions.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Good morning. So much milder conditions expected this week. Temperatures could rise up into the mid-teens in some places over the next few days, but it is going to be often wet and windy. In fact, this morning there are spells of rain across southern and eastern parts of England, and there are showers out towards the west, particularly across the northwest. And it's a breezy morning, but the wind's coming from that mild southerly flow, hence the fact it's not a cold start. But it is still quite chilly across parts of the northeast of England, where there could be some frost, perhaps even the risk of ice. And through the day, we'll see that rain clear from the southeast of England. There are murky conditions this morning as well that may be quite slow to lift and clear and may linger in some spots into this afternoon, but otherwise we'll see bright or sunny spells developing for most places this afternoon. And we'll see the continuation of blustery showers, particularly heavy across parts of the northwest of the UK and Ireland. It also turns increasingly windy across the west later. Some gales are likely to develop as we head towards this evening, as rain spreads to the southwest of England and to western parts of Ireland. And both these areas of rain will be moving north and eastwards overnight with heavy downpours. So at some point through the night, it's going to be rather wet once again, and it will be windy with showers following in from the west. Tomorrow, that rain clears from the northeast, but it will take some time for it to clear from southern and eastern parts of England. Elsewhere, there'll be brighter sunny spells, but blustery showers again.
The weather, sponsored by Qatar Airways.
Naz, thanks very much indeed. Let's take you back to my conversation with the Health Secretary a little earlier in the programme. Matt Hancock said, despite the current success of the vaccine rollout scheme, there's still a long way to go before the government can ease restrictions. He said the government is pulling together all the information before making any decisions, but he also mentioned that for now, people should still stay at home to avoid spreading the virus.
There's a long way to go. In a way, the most important message remains the message for everybody to stay at home and abide by the rules. I mean, it's pretty, it's pretty extraordinary and very positive how people are following those rules, even after all this time. And I'm very grateful to everybody. In fact, the support for the measures that we've taken is just as high as it was in the first lockdown, and you can see that the number of people who are following the rules is just as high as it always has been. But I know how the pressures that they bring. Of course I do. And so you're right, there's a long way to go.
Well, as we always do, let's remind ourselves as to the latest data on coronavirus here in the UK. 10,972 new confirmed cases of COVID-19 were recorded in the most recent 24-hour period. A further 258 people have lost their lives within 28 days of testing positive. Now, that is the lowest daily number we've had in 2021. Still, we shouldn't forget the fact that brings the UK total to 117,166. But as we've been mentioning on the show, the big news, more than 15 million first doses of the vaccine have been administered. We're right at the beginning of the vaccine rollout programme. The government brought in the armed forces to help organise the logistics of the massive operation. So far, it appears to have been very successful, all of which means it's rather handy that we can now speak to Brigadier Phil Prosser, the commander of the 101 Logistic Brigade, who's been leading the military support to the vaccine rollout since November. Brigadier, great to have you on the programme this morning. And I wonder if we might, from you, have perhaps an expression of pride at just how instrumental your men and women have been in ensuring the government hit that 15 million target.
Yeah, it's been an amazing feat, and I'm really proud to be part of this truly amazing team. I think it's important to say that I coordinate the military contribution to this team, but it is very much NHS-led under some amazing leadership who have done some amazing things to really hit this target over the last few weeks. From the very start, it's been an unprecedented operation by scale and complexity about getting this new vaccine into the arms of those who need it most as quickly as possible. So we faced challenges along the way, but it's a real point for reflection and celebration achieving this first milestone.
Certainly is. I wonder if you might just be able to elaborate a little for some of our viewers who are perhaps puzzled at that request to bring in the armed forces as to what exactly it is that you've all been doing. I will confess myself, my eyes were opened the first time I embedded with the British Army out in Afghanistan. So much of what our armed forces do revolves around logistics and deployment. So this was absolutely right up your alley.
Yeah, it is, and we excel at dealing with the frictions and chaos of war, but it doesn't have to be conflict or war. It can be any operation where that uncertainty can lead to complex requirement for plans, complex problems, can really play to the strengths of the military. And I think it's been something that we can really celebrate is the coming together of two world-class institutions, the NHS, who designed and configured to protect the nation through world-leading healthcare, and the military, who do this operational planning in uncertainty, facing complex times. And the coming together of these two world-class institutions is something really to celebrate. And I think what the military have brought in the initial phases, as we went from the planning phase into the delivery, we worked alongside the NHS to help understand exactly what was required, to go through the analysis phase in order to build resilient plans. And then as we switched to the planning phase, we brought what we're famous for, the discipline and tempo, to add that real pace to everything that we were doing here. And I think the complexity shouldn't be underestimated. You know, some of these vaccines are really complex to handle. We didn't know how the system, it had never been tested before. This was, you know, this is the largest vaccination program we've delivered, and we'd never done it before. So it was a real, and remains a real period of learning as we go.
Speak to us then a little about the challenges. Where have the greatest challenges been faced?
I think there's three challenges that have been involved in the early phases of this, and that's trying to go as quickly as we can to get it across the country equally, and to get it into some of the small communities where the risk is highest, such as in care homes. So those three challenges of going as quickly as possible, getting it into the arms of those who need it most, and doing it equally across the country, each come at a cost to each other. So the plan has to be constantly toggled to make sure we do that, because what we don't want is 65-year-olds in London getting the vaccine before 80 or 85-year-olds in Newcastle. So getting the distribution plan absolutely right has been critical, and also making sure we are agile enough to go into small communities, such as those in care homes. Last week we spent a lot of time going into housebound patients to make sure that if people can't come to large vaccination sites, we can take the vaccinations to them. So toggling those three things has really been the greatest challenge. But as I say, and as you said right up front, achieving this first milestone has been a real success. And being part of this amazing team and watching them achieve these things has been a real honour to be part of.
And now that we've hit that 50 million target and now look towards the target of 32 million, everyone in those most vulnerable groups, this is not the end of the Armed Forces' involvement in this programme, I suspect.
No, we'll stay here as long as the NHS need us and as long as the country need us to help in this amazing operation. We've now achieved offers to cohort 1 to 4. We move on to cohort 5 to 9 now, which we'll hope to complete probably by early May. But that doesn't mean we'll leave cohort 1 to 4 behind, and we'll need to go back to make sure that we've reached as many of those as possible and to maximise those uptake levels. But the military are here for as long as the NHS need us, and all my team and the troops on the ground are really proud to be part of this amazing operation.
And we're all very grateful for your participation. Brigadier Prosser, great to have you on the show this morning. Thanks for being with us.
Prosser, great to have you on the show this morning. Thanks for being with us. Great, thank you.
Well, let's turn our attention back to the domestic political situation. Get the view from the Labour side of the chamber. The Shadow Education Secretary, Kate Green, joining us once again on the programme. Ms Green, great to have you on. Obviously, so much to talk around education, schools and so on. But just a word from you. The government said they would get to the 15 million most vulnerable. It appears that they have done so. This is a moment to mark.
Absolutely, a moment to celebrate and to express our thanks to the NHS, the volunteers, the scientists and researchers, everybody who has contributed to this achievement. And I'm really delighted that the vaccination programme is rolling out and reaching people. We've all been desperate for it to progress, and it's great to see that we've hit this 15 million target. There is obviously a bit of a worry, Niall, about people who haven't come forward for the vaccination, who are eligible. And I think we have to have a really big push now to reach out to people who may be doubtful, who need some more reassurance, because obviously until we get these 4 priority groups and other vulnerable people vaccinated and eventually everybody vaccinated, we can't be fully safe. And so it is important that the government redoubles its efforts to reach those people at the same time as continuing with the vaccination programme for everyone else.
Indeed, and of course, successes in the vaccination rollout do not mean that people who are suffering in our communities, that suffering comes to an immediate end. Just on that topic, today Labour's calling on a transformation for support for families. Tell us a little bit about it.
I'm sorry, Niall, I didn't quite catch that.
Sorry, the Labour Party today is calling for a transformation for families, children facing a bit of a postcode lottery when it comes to that half-term support.
Yeah, absolutely. So what we've got as half-term starts for many schools up and down the country this week is that the free school meals programme, of course, isn't actually applying this half-term. And families have been told that they'll have to rely on the winter support grant that is administered by local authorities. There are a couple of problems with that. First of all, that winter support grant fund isn't just for school food, it's got a lot of pressures on it. And so families are going to have to apply for it and hope that there's enough money in the pot if they're worrying about how to feed their children. We're also concerned that the government's guidance to local authorities about this fund actually says it shouldn't be used to replicate or replace school food programmes. And now the government is apparently saying, well, yes, it should be. So with that kind of confusion, I think it's really quite concerning as we start half term. Families will be worrying about how they're going to feed their children. And I just can't understand why the school food programme that's been put in place for the summer and Christmas holidays and Easter can't be extended to half terms too, and why the government's just refusing to do that.
In terms of children returning to school, March the 8th, of course, remains the date that everyone's eyes are focused on in terms of England. Wales going back slightly earlier. I mean, is there an argument for the government in England to look again at whether or not we could get kids back into school somewhat earlier than that second week in March?
Important that the government is very cautious. I mean, what we saw, of course, was that the Welsh Labour government was actually quicker to bring in the lockdowns last year, the circuit breaker and so on. So we're on slightly different paths between Wales and England. But I do think that it's really important that the government here learns the lessons when it's released lockdowns too quickly in previous months and makes sure that it's properly examined the data, is absolutely clear that the metrics that it's going to rely on, and we need to know what those are. Is it fewer hospitalisations? Is it less transmission in the community, for example? Won't be harmed by the way in which they begin to release the lockdown. But clearly we've always said that we do think schools need to be the first fully to reopen. We're desperate to see children safely back in class. I just think it's important that the government takes its time to keep all options on the table. And if that means bringing children back on and after the 8th of March, perhaps on a staggered basis or perhaps in a rota system, those options need to be kept on the table too.
Which would be the worst option for our children? For the schools to reopen at the beginning of March and then at some point over the next few weeks to close again, or that we simply bite the bullet and push forward with remote learning for the majority of the school year?
I think it's a very difficult balance. And obviously the chopping and changing that we've seen during last term when children would go into school and then bubbles would be sent home again. Sometimes children were repeatedly in and out of school, perhaps 4, 5, even 6 times. That was very damaging and disruptive to their learning and very, very difficult for parents, working parents, to manage. So remote learning is a good way of stepping into the gap until children can be properly and securely back in school. But of course, we're still waiting for the government to deliver hundreds of thousands of the promised laptops to families that don't have the digital resources they need for children to be able to study at home. And of course, we do know that there is the possibility that from time to time, children will have to go home and study again remotely for a period if perhaps somebody in their own family is unwell and they have to isolate with them. So it is really important the government presses on with this laptops programme, gets those digital resources delivered as quickly as possible. But I would say that, yeah, you're right, Neil. Once we get children back into school, we really want them to stay there. And that's why it's important the government takes a cautious approach, but a sustainable approach, and that it's absolutely transparent with us about the basis on which it's taking the decision about the return after the 8th of March.
Kate Green, good to see you. Thanks for joining us once again.
Thank you very much.
Well, as the vaccine rollout continues among many of the world's countries, what can we learn from others? Pleased to say, Dr. David Nabarro, the World Health Organization's Special Envoy for the global COVID-19 response, joins us on the programme. David, great to have you on the show once again. And we so often dive straight into kind of the minutiae of countries' responses to the COVID pandemic. I just want to try something different this morning. Of course, many smiles here in the United Kingdom as we've hit 15 million first doses. How are you feeling, just in general, about the way in which the world is responding to COVID-19? Are you positive? Are you happy? You're always smiling in this programme. I just want to know how you actually feel about it all.
Well, actually, I feel pretty good. I have in front of me the daily report of numbers of cases of COVID reported from around the world. And I don't want to push it up to the camera because it's not easy to see. But over the period since mid-December, really, all over the world, the numbers have been coming down. A bit like what we see in the UK, which has been a dramatic reduction in cases, but globally also, it's the daily numbers, the weekly numbers have just been dropping. Why is that? It's really is because people have kind of worked out how they're going to get on with their lives, but at the same time stop this virus from spreading. It's absolutely amazing what's going on. But of course, once people start to move around again, then everybody's really quite impatient to get moving. The challenge will be to keep those numbers down and stop them coming up, surging up yet again. They are, I'm afraid, still rising in other parts of the world, in Latin America and parts of Africa. We've got some really nasty situations that are causing us some disturbance. But the overall picture, Neil, is one of really extraordinary efforts being made and good results. So if we can keep it up, then we can get on with our lives, if you see what I mean.
Yeah, well, I'm running out of fingers to cross, I have to say, David. But let's focus exactly that. But look, you mentioned there, of course, that there are parts of the world which are not able to keep pace with the United Kingdom, and you can certainly understand why that might be. All of which means we need to be really careful at guarding our borders from potential new variants. All of which suggests that we will be needing to see some form of international vaccine passport at some point in the not too distant future.
I'm absolutely certain that in the coming few months, we will get a lot of movement on what are the conditions around which people are easily able to move from place to place. Some sort of vaccine certificate, no doubt, will be important. But the other thing that's necessary is for different countries to have a pretty clear idea of how good the systems are each side of a journey. Because if you know that you've got the same sort of quality of systems to deal with disease, for example, in a part of Europe that you might want to go to for holiday, and that's similar to what's happening in your own country, then travel between the two sides, creating a bubble and so on, becomes straightforward. It's very important when it comes to looking out for the variants, as we call them, because this virus does change. It mutates quite frequently. And some of the mutations, only a few of them, are quite worrisome. We call them variants of concern. So you're so right. We've got to be quite vigilant from now looking forward, both inside our countries, because variants can appear inside our own borders, but also because sometimes variants can be brought by people from other places. That's going to be with us for the foreseeable future, because even when much higher percentages of the UK population are vaccinated, there will still be these worrying moments when perhaps a version of the virus appears that can break through the defences provided by the vaccine, and that becomes something we have to look out for. So it's looking good, everybody. It's looking really good, the British situation. But there is, I'm afraid, going to be a longer-term period of continued hard work, especially to find ways to come out of the current very, very strong lockdown situation that UK and other countries are in to a more relaxed situation. And we have to make that change with quite a lot of care.
Presumably part of the way in which we get the world out of all of this is those industrialised nations like the United Kingdom, which have over-ordered in terms of vaccines, that they begin to distribute that to the rest of the world. Has much work been done on that as yet?
Yes, there's a lovely scheme that's been set up internationally, actually at the request of all the different nations, with the UK right at the front of it, called COVAX. And this is a scheme that enables everybody in the world to benefit from negotiated prices for these vaccines, and also to be in a position where they can use the vaccines that have been approved by the World Health Organization after going through rigorous safety checks. We'd like to encourage all countries, whether they're rich or poor, to use this COVAX scheme. Built into COVAX is the possibility for a country that's managed to get hold of enough vaccines for its own vaccination programs, then to provide excess to the pool that can then be distributed to the rest of the world. We'd like to encourage countries to use this scheme. It's transparent. It's got all sorts of governance rules so that everybody knows what's being offered. But it does mean that every country in the world gets a chance to have a share, and poor countries can get some of their vaccine costs covered by the wealthy countries, which means that we do end up with a situation where even the poorest countries in the world can afford to immunise their health workers particularly, and others who are at risk. So appeal to everybody, use COVAX. It is a really great global system.
Dr. David Nabarro, you look after yourself until next we talk. For now, though, thanks very much indeed.
Sir. I'll come back. Thank you. Bye-bye, Neil.
Time to see how the weather is looking this morning. Naz had some good news of her own earlier in the programme. Makes a change. Naz, how's it looking?
Looking much milder compared to the recent days we've had, but it is also going to be rather wet and windy at times.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Good morning. So this week is going to be much milder compared to recently. Temperatures are going to rise into double figures for some spots, into the mid-teens over the next few days. And it's a mild start this morning too, but it is going to be rather unsettled this week. We are seeing spells of rain, for example, this morning across the south and east of England, and further west there are also some outbreaks of rain. In between that, it's mostly dry, but it's not that bright at the moment, as there are areas of mist, fog and low cloud across England and Wales that will eventually lift and clear to bright or sunny spells this afternoon. That rain should also clear the southeast, but showers will continue across the northwest, then later rain to the southwest and Western Island with windy conditions.
The weather, sponsored by Qatar Airways.